Welcome to Connecticut's Health Report. Episode 7, the Men's Health Checkup. With Connecticut Department of Public Health Commissioner, Dr. Manisha Jitani. Because being informed is the first step to being protected.
Good health doesn't just happen, it's built. The last time you buckled your seatbelt, did you think about it before you did it? Or turned on the tap and drank the water without a second thought? Or got a vaccine that protected not just you, but everyone around you? None of that happened by accident. Someone fought for it, proved it worked, and put data to action. Welcome to Connecticut's Health Report. I'm your host, Brittany Schaefer, and I'm joined by Department of Public Health Commissioner Dr. Manisha Jitani and special guest State Representative Geraldo Reyes, who has served Waterbury since 2016. And he's also a prostate cancer survivor who has become one of the most vocal advocates for men's health and routine screenings in our state legislature. Representative, thank you for being here and for your courage in sharing your story so openly. Now, June is Men's Health Month. It's a reminder that men are less likely to visit a doctor, less likely to get screened for cancer, less likely to talk about what's happening emotionally, and more likely to wait until a health problem has become a crisis before seeking care. Now, prostate cancer is the most common cancer among men in the United States after skin cancer and the second leading cause of cancer death in men. And yet the conversation around prostate cancer, including screening, diagnosis, treatment, remains one that too many men avoid. So Representative Reyes, how did you find out about your prostate cancer diagnosis, and what was that moment like for you?
Well, Ms. Brittany, thank you very much. Dr. Zitani, thank you for having me on. I'm now 3.5 years past finding out. When I first found out, I was kind of stunned. I really had a regular family doctor. He was my doctor for about 30 years and never had an issue. And I was one of those guys that actually said coming to these yearly physicals is a waste of time and money because, knock on wood, I've had 30 good years where you're good, they check the box, you're good. Mm-hmm. That doctor retired, and I was without a doctor for about 4 months. I couldn't find it's hard to get on these with the new doctors. So I was fortunate to have recommended to me a Colombian doctor who did what I call a deep dive for a full physical. I don't remember having any physical that complete or that thorough in the 30 years with a doctor that I was very comfortable with, and I was wondering, did we just get so comfortable that we didn't even get to talk about my health, and we just talked about the Yankees, Pirates, and Red Sox, and were we just too comfortable? And this Colombian doctor detected something in one of my physicals, detected something in the blood, and sent me out for PSA. He says he had looked at the colonoscopy report, and he had saw some things that were detected as minor, and probably was taken care of right then and there. I don't recall all the facts right now, but he detected something in the blood, and he sent me out for the PSA, which is for the prostate specific antigen number. And he said it was unusually high, and that I should do a complete checkup for that. And that was the origin of finding out that I had prostate cancer. I didn't know to what level, but I did go to the specialist and the urologist, and everything was confirmed. I don't recall a lot of the conversation. I don't recall how much, to what degree. I don't remember that because, honestly, I may have been taken back and stunned by the fact that I had prostate cancer. So a lot of those specific numbers I don't remember. But I've been a completely active person my whole life. I played baseball, basketball, I played sports till I was in my early or late 50s. So I felt good, and I was stunned, to be honest with you, but it was determined by a blood test and by a thorough examination by a Colombian doctor that I just happened to meet.
Wow. I think a lot of cancer survivors I've spoken to would have the same sentiment that you do, is just stunned that they've been healthy their whole lives, and it's just very unexpected. So, Commissioner, can you help Connecticut residents understand prostate cancer, including how common it is and who's at highest risk?
So Representative Reyes is right. Prostate cancer is one of the most common cancers for men in Connecticut. And one of the reasons for that is because screening is much more common, and we do have a very highly insured population. So if you screen for it with the PSA test that you were screened with, you can potentially identify it. One of the challenges, unfortunately, with prostate cancer also, though, is that for some people, it's not going to be that aggressive. And if you find it, it may actually not change your long-term longevity. So for some people, there's often a saying that people say, you may die with prostate cancer rather than from prostate cancer. Because changes in the prostate happen with aging. That is normal. Many older men will talk about, if their prostate has gotten larger and they have challenges with urination or challenges with starting a stream or ending a stream in terms of urinating. Those are common things, and those are not necessarily cancer. So one of the things I would really encourage Connecticut residents to do, though, is to have this conversation with your doctor, because screening is generally recommended between the ages of 50 and 55. But for most doctors, they're going to say that it is a decision that they want to make with you. Because once you have that test, that does start a cascade of events where you undergo a biopsy, where you then figure out what the next stage is. And for some people, it is meaningful steps. And we really want to help prevent having metastatic disease around your body, which that certainly has life-changing circumstances for. But you also don't want to have people undergo tests and procedures that are going to have more complications than the disease itself, which is why it's a very personalized decision. So I think it's really important in your situation, Representative Reyes, where you found this out, you were able to take next steps, and you continue to remain in good health. You can tell us a little more about that. But I think that isn't always true for everybody, which is why it's really important that people talk with their doctors.
And talking about those next steps, what were the treatment options like for you, and how did it change you today?
Well, that's a great question. So you're immediately, when you visit your urologist and you consult with your general practitioner, you're overwhelmed with a lot of data and hopefully a lot of options. Because if they tell you don't have too many options, that's actually the worst case scenario. But I had several options. They were monitoring me for 3 months, and the best solution that my doctor said was, you should probably have a prostate cancer, a prostate operation, which, going through all the scenarios, I decided that was probably the best way to just. It was unfortunate for me. My PSA number was high. They get concerned at anything over 5 and 6, and I was already a 9, and then I was creeping towards 11, and so I was going in the wrong direction, and I was going in the wrong direction in a very short span of time. So if I had gone from 9 to 11 in a matter of 5 years, that's one thing. To your point about time, but I went from 9 to 11 in less than a year. And it was recommended that it was time. So what it told me was that it wasn't in any stage where it was life or death at that point, because if it was life or death, they would have given me different options. So I chose to have the operation, which I had here at the Hartford Hospital, and they were wonderful. They, it's amazing. You're in and out of there in less than 30 hours. The difficulty comes when you're trying to do home, especially your mind says you have to go to the bathroom, but you really can't. But your mind is telling you got to go, you have to go. So you keep getting up because that's what your mind's telling you. Your body's not ready for any of those things that they're talking about, that you're imagining. So it took me a while to adjust, probably a week by the time I was home, adjusting to what was a real urge and what was really. And I have to tell you that I was fortunate that I got in there in time, number one. Yes. But I wasn't fortunate in the respect that I had to go to another step. So they were not able to get all of the cancer. So I had to prepare myself mentally, physically, emotionally for the next step, which my doctor told me was a possibility, that I would have to go back in either with chemo or radiation. And we chose the radiation, and we chose 50 treatments at the Harold Lever Center in Waterbury. So I had an opportunity to go to Yale, but I live in Waterbury, and I've heard great things about the Lever Center, which I got to experience firsthand. They're a class act. And I went there for 50 treatments, Monday to Friday, every day at the same time, for the radiations, which at first, in my mind, I didn't think it was doing anything. I felt the same. You don't really feel anything when you leave out of there. But eventually it took a toll on my body. It was doing something to the inner works, and I was fatigued, and I didn't have the energy. So eventually all the things they told me were going to happen did happen. And it took its course. So those are the first. Yeah. So I was one of those that had the prostate cancer operation and the chemo and the radiation. And knock on wood, the PSA number right now is 0.01. So it's pretty much untraceable.
Wow.
And I will I will find out where I really stand in October once all of this has gone through my body. Your body's changing. You don't feel it. You don't see it. But you could your actions tell you you're a little more tired than you used to be. You're probably going to bed a little earlier. And being a very active guy like I am, I'm on the go all the time. So that's how I could tell that I didn't have that energy anymore.
Wow. It's a very interesting perspective to hear. I mean, it seems like you are doing really well, which I'm glad to hear, but surgery and radiation is a lot to go through. And it's just interesting to hear kind of how that did take a toll on you. So when you talk to men, constituents, patients, friends about prostate cancer screening, what do you hear most often as a reason they haven't gone, and what do you say back?
You know, that's the $100,000 question. As I said earlier, you know, most men, and I like to think that we have more people insured now than we had in the past. I could be wrong, but I like to think that men have insurance, and they're more concerned with their family and children's health and making sure that they get to the appointments and so forth. And men always put themselves last. And I've heard the same conversation also said about moms putting themselves last. But, you know, I think that men still have that stigma. Dr. Jitani and I have talked about this. There's still that stigma that men are macho men and they don't whine and, you know, cry. And they keep everything to themselves. Their grief, you know, whatever, their ailments, rather than take advantage. You have insurance, you have a doctor, you know, just get it checked out. And I can tell you personally that I have friends that into their early and mid 50s that had never had a colonoscopy, and I always the first question I ask them, has anybody in your family ever had cancer? You know, just as an icebreaker. And then if they say yes, I try to get down to what type, because why I say that is I'm surprised at how many men don't have any historical perspective of what their fathers or grandfathers or uncles have gone through. So there's the first misstep. No communications from the previous generation, whether it was from the elders up or from the from us down. So there's no many don't even know that the cancer's in their family, because if you already had a history of this, you probably should have gone in your 40s to get your colonoscopy, and especially to find out what your PSA numbers are.
Yes.
So I think the first missing step is the lack of communication and the openness and frank conversations that we could have right here that are not being had at certain families. And I will tell you, Hispanics and African American families are the worst when it comes to health and health awareness and self-care, by not sharing with their siblings or sharing with their sons or nephews, whatever, that hey, Uncle Joe had this, grandfather Pop had that, you know, and so forth. And I found out I had two uncles that had cancer after I went through all this.
Oh my goodness.
Wow.
The
So
conversation,
that's the first step.
so important. So important. So let's talk about colorectal cancer. It's one of the most preventable and treatable cancers when caught early, and yet men are less likely than women to be screened. What do Connecticut men need to know?
So Representative Reyes mentioned getting screened potentially even in your 40s. And the recommendation used to be at 50, you start getting screened. But that recommendation, at least from the American Cancer Society, has actually gone down to 45 even now. And so certainly if you have a family history, you need to be thinking about this earlier in life, usually about 10 years earlier than when your loved one may have had whatever disease it may be. But I do think that there is a certain vulnerability that people need to have to acknowledge what family members have had, to have that question, have that conversation, have that vulnerable moment to say that, you know what, we don't need to all be so tough or so macho, and that these are real human things and it's okay to talk about them and then to go forward with it. So as it relates to colorectal cancer, whether it be something like Cologuard, where you're getting screening every 3 years, or a colonoscopy every 10 years, those are the things that we want to become part of routine practice for middle-aged people to be thinking about and talking about, and certainly for men who I think a lot of times are preoccupied with their responsibilities for the family. But a lot of these types of screenings sort of fall to the wayside. I think that women have gotten in this collective spirit of talking to each other about their mammograms and did you get your mammogram? And it's almost like a collective enthusiasm to tell your friends to get their mammogram. I don't hear of men talking about, did you get your colonoscopy, or did you get a PSA checked? And I think that's part of what you're trying to do, Representative Reyes, is encourage that conversation and encourage the conversation for men to be having with their providers.
What actually does seem to work when having these conversations and trying to move that needle to get more men to do these screenings?
That's a great question. I have my perception of this and what I've been able to realize and see with my own eyes and watch. The personal touch works. I put it out there after I thought it out, and I says, you know what? I have known men that have died of cancer, and I don't even know what kind of cancer. I just took the opportunity and says, you know what? I'm gonna just put that out there, and see what it brings, see what attention it gets. To my shock, it was I received so many so many messages, so many texts, so many emails, just for speaking out and just becoming a spokesperson for this. And my intent was that I know I can speak for Hispanic men. We're the worst. They don't want to know nothing about the doctor, and it's unfortunate because more often than not, when they get there, it's stage 4, stage, it's a bad thing, because as I said earlier, they don't use their insurance. So I put it out there because I had a platform where I can reach a lot of people in Waterbury, and then I expanded it to the region. But secondly, I was able to also get the message out in Spanish, and I went on Spanish radio. And I put the message out there about getting tested, and nothing ventured, nothing lost. If you're fine, you're fine. But now you know for sure. And believe it or not, then I took this on a national level, and I've spoken on men's health and prostate cancer in 4 different states, and I will speak again in Waterbury at a men's health forum on a Saturday morning. And I will be speaking on men's health and cancer at the Relay for Life at the end of June. So I'm just constantly, they invite me, I show up.
Yes. Gosh, thank you for what you are doing, Representative.
I think a few other things I'd say on this is Representative was instrumental in helping DPH get funding to have a men's health campaign. And one of the things that we were able to do with that was both in English and in Spanish, on social media, on radio. We had different very targeted messages that we actually did testing in male audiences to see what would resonate and try to make ads that actually could resonate with men to actually try to take charge of their health and move forward with some of those initiatives. And so I found that it was a really successful campaign, at least from the metrics that we could look at. Of course, it's hard to know how many people took the next step with actually going out and doing that testing from the messages that we had. But I do congratulate you for that initiative, because that was able to help us get the word out on what are the interventions men can do to be able to help take charge of their health.
You know, to that point, Dr. Jitani, like I said, the personal interaction works. I have personally talked to and convinced at least 20 men that I've known that have gotten tested. 6 were tested positive for colon cancer.
Oh my gosh.
2 have been operated since. So the personal touch does work. To your point, you know, what the radio and the TV ads have done, it's hard to say, but at least 20 men that I know of that at least heeded the advice and went and got tested.
Wow.
6 tested positive and 2 have already been operated.
It's outstanding.
And so that encourages me to do more,
Yes.
you know, speak up more. You know, I just saw something on the way this morning. I'll share with you. I just saw something this morning. One of the side effects that happens with this prostate cancer, whether you do surgery, you have leakage. When you urinate, you have leakage. So this whole thing with diapers or the pens, what a stigma for men. Are you kidding me? So what you know what I saw this morning on TV? Deion Sanders doing a commercial for the pens.
Yeah.
That's amazing.
Now you got this big bravado Hall of Famer in football actually doing a commercial for men wearing the pens, and wow. I said, now that's a giant step forward.
Yeah.
And that's what's needed.
Yes.
That type of quantum leap where a highly recognized person is going out and putting his vulnerability out there like that.
Yes, as you are, and it's without a doubt that you have either made someone's outcome much better or even saved lives. So thank you so much for what you're doing. So now switching gears a little bit, heart disease kills more men than any other disease. Can you walk us through the key numbers every man should know, like blood pressure, cholesterol, blood sugar, and what it means if those numbers are off?
Well, you're absolutely right, Brittany. Heart disease is actually the #1 killer of men. And there are so many aspects of the downstream consequences of heart disease that we can actually prevent. So we know that we have bypass surgery and all these incredible interventions that can be done once you have a stroke or a heart attack, or maybe to prevent a stroke or a heart attack. But you can go much earlier than that, which is to know your cholesterol numbers, know your blood sugar, know your blood pressure, and try to get them under control before you actually have advanced disease. And so this is true even for young men, because knowing those things earlier in your life and making sure they're normal, so that the minute you see that something is different, you can actually take some action on that. So Representative Reyes, as you mentioned, you went in for 30 years. Well, you got your blood pressure checked every time. You probably had your cholesterol checked a bunch of times. Probably had your glucose checked a bunch of times. So heart disease, diabetes, hopefully you don't have any of those. And even getting those regular screenings is something that a lot of people don't do. But I think that knowing what those are earlier in life is important to make sure you stay on track for health.
An ending note, if each of you could get every man in Connecticut to do just one thing for their health this month of June, just one single small step, what would that be?
For me, it would be getting their blood pressure checked. Because for young men, even to know what your blood pressure is, it is the one thing, whether you're young, whether you're old. A lot of the other things, it depends on your age, depends on your circumstances, depends on your family history. So there are a lot of caveats. The one thing that has no caveats is a blood pressure. And heart disease is the #1 killer of men. So if you have not had that checked in the last several years, please just get your blood pressure checked.
An easy task. And for you?
Well, I mean, I'd be remiss not to mention the prostate cancer, but recently we've learned of perfectly healthy men dropping from heart attacks, and I think that this new test that's available, which is for the coronary calcium scan, which is that tests your heart arteries. Unfortunately, we learned it through a bad situation of Representative Exum losing her husband to this particular disease. The man was perfectly healthy and in better shape than most men. And this test this simple test, which is really not expensive, it's a couple $100, I think, would have saved his life. And so I would say I would add a test for your arteries as well as your prostate.
I'll definitely have to look into that. Thank you for mentioning.
And I'll just mention that coronary calcium score that you can get through a CAT scan. You should really talk about that with your doctor. Certainly young men, it wouldn't really be that advantageous for. But for a middle-aged man, and certainly if you have certain risk factors, that may very well be something you should consider.
Thank you so much, Commissioner Giuttani, Representative Reyes.
Thank you.
I really appreciate both of your time. This was the conversation Connecticut men deserve to hear, and your story is so moving. To the men listening, you just spent 20 minutes or so with us investing in your own health. That matters. Now take the next step. Make the appointment, call your doctor, tell your son, your brother, your friend, your father to do the same. Men's Health Month is 1 month, but taking care of yourself is a decision you make every day. Until next time, this is Connecticut's Health Report.
Thanks for joining us. Catch the full video on YouTube and stay connected with us on social media for the latest on health in CT. See you next episode.